Hi, you guys. This is Jewel just checking in with you after week 1 here of Nursing Research Online. Thanks so much for your posts that you did and your responses to one another. I really appreciate you engaging with the forum. And quite honestly, it helped me to get to know you all a little bit better too. Thank you for completing the library training. I hope that you found that helpful, or at least a good refresher on how to go about finding some articles. As we enter into week 2, you will spend time working on your PICO questions. You guys started having really good discussions, and I can tell that you're brainstorming on what you might be interested in doing research on. So I appreciate all of that. And I just wanted to kind of recap the things that you guys posted. Abby, you said some interesting things about, with your background in OB, of doing research on the benefits of delaying cord clamping for infants. And then you also posed what I think could be a really interesting thing to study in nursing research in the form of kind of a PICO question of your population being perhaps a specific floor. You might want to narrow this down to OB nurses that float to med-surg floors, and how is the quality of care different when you have a float nurse. Again, I would assume that research is going to show us that perhaps there's more medication errors, or is the standard of care really that well kept up when you have nurses floating outside of their particular area. So that could be really interesting. Grace, with your background in working on cardiac telemetry, I think that the questions you were posing about new and improved anticoagulants is really interesting. That seems to be something that I see in other classes that I've taught here, of just how many are out there and really what is driving the choices of putting patients on different ones. Is one better than another, that sort of thing. And then Grace, I appreciated that you said, when there are some things that we do just day after day that are just very simple kind of evidence-based practice things that we almost forget about them, such as this idea of, we know if we have a C. diff patient, that research and evidence has shown us that we are much better off using soap and water and actually washing hands rather than using a hand sanitizer for those patients. And so it's those little things that we do in our practice that are based in evidence that we sometimes kind of forget about or overlook. So thank you for pointing that out. You also mentioned an interesting statistic of keeping adult patient saturations above 92%, and that's really the standard that we need to have the human body functioning well. And so you could do something with that knowledge too of is there a specific patient population where it might be beneficial to have a lower saturation? I know from the pediatric world and the NICU world, we would have different parameters based on different patient diagnoses, and we would sometimes run our infants with saturations as low as in the 80s, but then those were cardiac babies, so a little bit different than what you're looking at. Ashley, you as well posted some really interesting things about the use of bed alarms and how we sometimes think that we are helping our patients by using these tools, when in fact this may actually be causing more falls, so we may be doing more harm than what we think that we're doing. You had also discussed the use of Coumadin and whether it's ordered morning, noon, or night, and is this have any effect on the patient? Is this just physician preference? What is kind of behind that? And then also that idea of looking into these new Aquaseal dressings that you mentioned, looking to see what research is out there about what are the best sorts of dressings to be putting on surgical incisions. Is this really just the newest, latest, greatest thing? Is this proven to decrease infections, as you mentioned? Is this just simply physician preference? And then what is the cost associated with this? Is there something that would be equally beneficial to patients and yet perhaps cost less? Or is this simply just the cheapest dressing and therefore it's what's being used? So again, thank you for everybody that participated. Lisa, I know that you've spoken with me, and just do your best here of kind of trying to get caught up with us for week 1. For week 2 is when you're really going to start delving into those PICO questions. So you've started giving that some thought this week. Again, A PICO question needs to have 4 parts to it, and I would suggest as you're brainstorming that you just actually put on your paper the letters PICO, and you could do that 3 sets of that. Make sure that you have a population that you're looking at, that you have an intervention group, that you're doing something with one group, you have a control group. So again, going back to Abby's, the population in the intervention and controls get a little bit confusing in that your intervention group would be, your population is, I think, the patient care, really, or whatever unit I guess you're looking at floating to, perhaps. The intervention is the care that's given by the float nurses versus your control group is care that's given by your standard floor nurses. So maybe you're measuring patient satisfaction or patient safety or just overall patient outcomes when on a med-surg unit with 20 beds, when you have a float nurse caring for patients rather than a regular floor nurse caring for patients. Would be a starting point. So again, we're going to spend some time this week working on PICO questions. So by Wednesday, you'll need to have posted something in the initial forum post, and by Sunday, you'll need to reply to one another. You this week need to do an attempt at completing the literature review grid. Again, many of you mentioned for week 1 that research can feel pretty daunting, and I agree with that. It can feel heavy, it can feel dense. So using this literature grid kind of helps you focus on the things that you're trying to dig out of the assignment. Do the best you can with it. Again, I am not expecting perfection. This is your first time of doing a literature review grid for me here in Nursing Research, so I really take this as a learning process. So I want you to fill it out, turn it into me, do the best you can, and then by the beginning of next week, I will post a kind of an overview of when I did the same literature review grid. This is where I went with it. This is how I would qualify this study. This is the variables that I saw, and you can kind of again, do a self-check. I'll grade those as well, but you can kind of check yourself on where you agreed with me on things. And then the last thing that you'll need to do is just really make sure you understand the 3 basic types of qualitative research. That's what we're working on this week. So make sure that you know ethnographic research, that you know grounded theory research, and that you know phenomenology. Those are your 3 buckets. So spend a little bit of time and make sure you can define all 3 of those concepts and what makes them similar and different. All right, as always, please be in contact with me if you have any questions, if you need to run your PICO questions past me, that sort of thing. And again, great job with week 1.